Welcome to Coronavirus What You Need to Know. This is our 13th live town hall program in the series, which has covered an unforgettable time in our community over the past 3 months. Adding to the incredible death toll of the COVID-19 crisis, we've also debated stay-at-home orders, we've seen political and cultural divisions come into sharp focus, and now we examine how community uprisings in response to egregious injustices are intersecting with coronavirus public health issues. Welcome to the show. I'm Darren Lashelle, President and CEO of Northern California Public Media.
And I'm Adia White, Assistant News Director at Northern California Public Media, and your co-host for tonight's show. Protests against police brutality continue across the country tonight. In Santa Rosa, hundreds of protesters have gathered over several days in Courthouse Square to demand justice for George Floyd, who was killed by police officers in Minneapolis on Memorial Day. In the beginning of today's show, we'll take a break from our coronavirus coverage to reflect on where we are as a community. Meanwhile, Sonoma County is moving forward with reopening, including opening barbershops, hair salons, some religious services, and coastal beaches. The county's public health department's Rohish Lal will join us tonight to talk about what this means for our community. Tonight will also be our last coronavirus town hall, at least for the time being. Darren Lashelle has more on how you can continue to submit feedback for future coverage.
These town hall programs give you the opportunity to ask public health officials, medical professionals, elected leaders the questions that are on your mind. And although this is our last program in the series, you can still submit your questions through the contact form on our website, norcalpublicmedia.org/coronavirus. NorCal Public Media will continue to cover the pandemic in news reports on KRCB TV and KPJK TV, as well as KRCB Radio and online. Now, many demonstrators this past week would have also taken to the streets in 2013, when 13-year-old Andy Lopez was killed by a Sonoma County Sheriff's deputy while carrying a toy gun. Today marks what would have been Andy Lopez's 20th birthday. A vigil is being held for him tonight. Yesterday, co-host Adia White interviewed freelance photojournalist Eric Castro, who covered the Black Lives Matter protests in Santa Rosa over the weekend. They talked about what he observed in terms of safety and what he hopes people will take away from his photography.
I wasn't too sure about covering it. I always have this idea that Santa Rosa is in a bubble, to be frank, and that they don't react. So I had actually just gone down with my niece. I brought her down, but I brought my camera equipment in case I saw something interesting. I brought 7. And as soon as I got there, I realized that this town was like every other town in the nation, the way it was reacting. It was palpable. So I didn't have an idea, but my idea always is, when I do cover, is just to cover things that I haven't seen in coverage, to really look for images that tell the story with clarity, and maybe stay away from the images I've already seen before of what I'd seen being covered in the event. So I have a very individual approach to the aesthetic. I think that's important to articulate in the way I see things. So it may sound a little high-minded, but essentially it means I try to give it my own personal perspective of what it felt like to just be a spectator.
And the Santa Rosa police have declared a curfew starting at 8 p.m. Will you be going out covering protests on Tuesday?
I haven't decided. I feel like in some ways I feel like I got lucky covering Saturday night. I covered a good hour and a half just of this one half block because there was so much tear gas activity and non-lethal weapon usage. And the whole time I covered, every time I wasn't shooting, I either stood in a doorway or stood behind a car or stood behind some type of metal object to shield me. I just sensed that somebody was going to get injured. So when I heard that woman or that person call out for a medic, and I came and saw what was a 20-year-old girl with a severe head injury, bleeding, and actually getting aid from a medic that was on site at that time. And I ended up photographing that moment. To be honest, I wasn't surprised to see it.
After several days of these protests, there is concern about further spreading the virus. Did it seem that protesters were wearing masks, and what about law enforcement?
I believe law enforcement was. it was really difficult to see. In fact, especially at that night moment, the line of riot gear police were almost in no light. It was extremely difficult to photograph them. They were very dark, so I couldn't tell if they're wearing any sort of mask. I'm sure they had some type of mask for the gas. And then I'd say a vast majority of the protesters were wearing masks. I think both for protection and both as an aid for the tear gassing.
Are there any other photos that you took that you'd like to highlight that you think are really iconic of these protests?
You know, there was the photo of the young protester holding up the Black Lives Matter photo. He's singled out to the left of the frame, and he's standing in front of the police station. And to the right of the frame, you can see the graffiti of Andy Lopez's name. To me, I remember thinking that was an important photo when I got it. It was a lucky shot because I tried to get there a little quicker. But it seemed to take the national issue of what's happening right now and remind people that there was a local issue at the same time. So I thought that was an articulate photo showing a local name with a national movement that's happening. I think to me, I think the photo of her name is Michaela Staggs, bleeding with the headband, and the face mask coming under her face will always mark it as a pandemic moment in a national crisis during the George Floyd protests. I truly think that that photo I took of Michaela is probably the most important photograph I've taken since I've lived out here. It seems to graphically depict where we are as a nation. I think it depicts we're living in quite aggressive, violent times. That's somebody's kid. Yeah, my apologies again. I usually don't get this emotional. I can check them. I guess I haven't really processed a lot what's happened, but yeah, I'd say Michaela is the most iconic photo I've photographed in quite some time, and the blood to me looks like tears.
Is there any message that you'd like to leave people with looking at your photographs that you think people should understand?
Possibly that they're photos of of a person just really trying to document the anguish of the country in where they live. And I think every photojournalist has been doing that. They try to really photograph the pain and anguish that everybody is feeling and everybody is dealing with, wherever they're covering. Personally, it's the history is being playing out in big cities like Minneapolis, New York, Los Angeles. Those have always been hotspots historically. Los Angeles. I was in Los Angeles during the Rodney King riots. My father was there during the Watts riots. Those cities seem to react in those ways. But this is a reminder that this happens in small towns like Santa Rosa.
Health Officer Dr. Sundari Mace usually joins us every week, but was unable to make it tonight. In her place, we have the County Health Department's Rohish Lal, who has also been in our town hall every night along with Dr. Mace, although behind the scenes. So thank you so much for coming tonight.
Well, thank you. Thank you for having me.
I'm sure you all have been really busy this week. How are you all holding up?
Good. We're busy. Since this whole event started, and we're happy to be in and work with the community and make sure people are safe.
Well, thanks again for taking the time to come into our studio. So Dr. Mace usually gives us a short update about how many cases we have in Sonoma County. What are the numbers tonight?
So the numbers tonight are we have 566 positive cases. We have 26,409 negative tests. So that's kind of the latest. I will add that around this time, our data is updated. So by the time someone might see a viewer might see it, it might be outdated. So just a word of caution.
And I know some of the things that we've been looking at are community transmission and also the percent of positive tests coming back. Has that data changed much over the past week?
No, although we continue to get data. So I would, if that's something that interests, people, I urge them to look at our dashboard, which is updated daily.
which again is at socoemergency.org and also on our website, so you can check that online. So we have seen a number of protests here in Sonoma County, and specifically in Santa Rosa, as well as in Petaluma. We also have a vigil being held tonight for Andy Lopez. A lot of people have written in with concerns that the virus might spread during these protests. Is that something that the health office is concerned about at this time?
Before we get to that question, I did want to say, just acknowledge the events of these past few weeks are horrific. And, while some of our words can't really describe the pain adequately, and, a lot of us are feeling this way. And we've made progress in a lot of arenas. Although we've done this progress and this great work, I think these past events just show the work that we continue to need to make as a country. From George Floyd's death last week, and Breonna Taylor's in Louisville, and Ahmaud Arbery, just all the events in Minneapolis, and just here locally because of this, and of course Andy Lopez, as we had the anniversary here this week of his passing. So I think we just want to acknowledge that before we go forward. But as far as your question about protest, we acknowledge people's rights to protest, and if someone does end up being positive, we will do contact tracing to the best of our abilities, and just follow up on where the person may have been and any known contacts, whatever that might be.
And we certainly want people to stay safe, while protesting, while standing up for their beliefs, because this, as you said, is an extremely important time for our country, and we want people to be able to go out. So do you have any advice for people who are protesting during this time about the precautions that they can take to ensure that they stay safe?
Sure, and that is wear a facial covering if you're going to go out in public, and if you are going to protest, wear a facial covering, and also maintain the social physical distancing of 6 feet that the health officer recommends.
All right, and so the first viewer question we have about this is, if someone at the protest tests positive, how will their contacts be traced?
So like I had said, to the best of our abilities, we'll, once we identify a person and, they give us their history of where they've been out in the community, it could be that they're outside of the protest, they're in other areas. So like we would do contact tracing with an individual in any other setting, we would follow up and do the same procedure for a person at a protest.
Right. And I know a number of other public health offices are recommending that people get a test if they have been at protest. Are we recommending that at this time?
If a person thinks they would, if a person would like a test, we have testing available, and anyone is urged to get testing, whoever wants it.
And again, we are testing asymptomatic people at that time, so
yeah,
it might
our
not.
two OptumServe sites, Petaluma and Santa Rosa, are available for anyone to get testing.
And again, we have more information on our website, as well as the county has information on their website about how you can go and get a test if people are concerned about that. Do you have any other advice for people during this time who are considering gathering, recommending,
Yeah, keep a bottle of hand sanitizer if you're able to get it. Try to keep your hands clean. Try not to touch your face, and maintain the rules that I just mentioned: social distancing and wearing a facial covering.
All right, so we are also learning more about our county's reopening plans. There are some major announcements today about plans to reopen hair salons, coastal beaches, churches, indoor dining. What's the timeline on some of those?
So we made an announcement a little bit before I arrived here that the beaches and the parks will be, there's an opening for coastal parks and trails beginning tomorrow. It's walk-in, and our beaches are open between, and the beaches are still closed between 11 and 5 a.m., or p.m. rather. This order allows individuals or any household groups to drive to coastal parks for lower risk recreation. That includes hiking, walking, running, fishing, surfing, or water sports, as well as for sunbathing and relaxing on beaches. And that starts tomorrow.
And then what about some of the other things, for example, hair salons, churches, indoor dining?
Sorry, to clarify, I think I misspoke. This supersedes the previous order, which closed the beaches between 11 and 5 p.m., so this would be open for daytime use.
That's some exciting news for a lot of people
Yes,
in Sonoma
yes,
County. I know
yeah.
we've been getting that question a lot into our
Yeah.
newsroom.
Yeah.
Yeah. So as far as other openings, including hair salons and the following, are there any new rules and requirements that people should be aware of?
So we don't have a lot of detail quite yet. We're still working on that. Again, as Dr. Mace has said, as long as the epidemiological local data supports reopening, we are looking to that. She had put in a 2-week, from last week. She said, we'll see our data for the next 2 weeks. So far the data looks good, and we're targeting a Saturday for that. So more to come, and we're hopeful.
All right, so we'll have to stay up to date on all that.
Yeah.
So meanwhile, we had some confusion over the weekend with our County Sheriff, Mark Essick, announcing he would no longer be enforcing the county's health order. And then on Monday, we learned that he had changed his mind and would be doing so. But one of the reasons that he cited for changing this is a risk-based approach. He cited that the county is now adopting a risk-based approach. Can you talk about what this means, and is it new?
As far as the health officer is concerned, this isn't a new approach. We've always used a risk-based approach. We're certainly open to more communications from our law enforcement, including the sheriff, and we look forward to meeting and communicating with him on a regular basis.
And although that you have reached an agreement for now, he will be enforcing the order. Is there a concern that if he again decides not to enforce that order, that people might again start to violate some of these health orders? And what advice do you have for people who are confused about the mixed messaging?
So I think to answer your question is, we believe we're at a good place, and that the sheriff will continue to enforce the order as he's done. As far as any confusion goes, I think we're a little clearer now on where we are, and that people should be abiding by the health orders.
So we've also seen a lot of new data released this week. For example, one of the things that you're now citing are the sectors of employment most affected by COVID-19. What does this new data show?
So this new data shows where people who have cases are working. However, we'd like to clarify, just because we have data that's job sector specific, it doesn't mean that the place of employment is necessarily a point of where transmission occurs, or where people may contract it, or are most vulnerable, for instance. There are different, for instance, if you've been working while you're an essential worker, for instance, you're a healthcare worker, or you're a first responder, or you are in the food service who've continued to operate, such as a grocery store, the sheer volume of you being out makes you at risk compared to the general public who's been sheltering in place.
All right, Rohish, unfortunately, that's all we have time for tonight, but thank you so much again for joining us.
Right.
All right, next we go to Darren Lachelle, who will tell you more about how you can submit feedback for our program.
You can share your questions with us so that we can get answers for you as we continue our coronavirus coverage into the future. Use the contact form on our website at norcalpublicmedia.org/coronavirus. Fill in your question, your name, your email, select your subject. On every page of our coronavirus section of the news part of our website, you'll find those stories and also frequently asked questions. Tonight's program is also being translated in Spanish live on La Mejor Radio 104.1 FM. We thank La Mejor for their partnership in these town hall programs and for the service that they provide to our community. According to the Los Angeles Times, unemployment in California has jumped by 15% in the last month. Adia White spoke with the executive director of the Sonoma County Economic Development Board, Sheba Person-Whitley, and Sonoma State economics professor Robert Eiler about the economic outlook for Sonoma County.
Robert, let's start with you. According to state data, about 1 in 5 workers in Sonoma County lost their job in April. What industries have you observed to be most affected?
Well, initially the two most affected were other services, sort of as a categorical industry, which include a bunch of sub-industries like fitness centers, yoga studios, hair salons, nail salons, things in which there's relative proximity to the client. And then also in the broad category of leisure and hospitality, which is mainly restaurants and hotels and some attractions, including casinos like Graton Casino. That's where we've seen a lot of the job loss initially in April. Retail has also taken a relative hit. Software has taken a little bit of a hit. Those are kind of the big categorical changes. There's been very little, let's say, specific industries that haven't lost. So even construction, where there were some construction projects still going, Sonoma County generally put the damper on, let's say, interior construction. But now that it's opening back up, we should see that industry specifically recover quicker than other ones, because it's more rapidly going to get back to square. February was sort of the last month of normality. And then over the last 2 months, about 54,000 people who live in Sonoma County who were working have asked for unemployment insurance benefits to begin. So if you see it through that lens, a little over 20% of the workforce that lives in Sonoma County has now asked to go on unemployment since March.
And what does this tell you about the challenges of recovery? What do you expect to see over the next few months?
So I think it's going to be a couple of different things as we, loosen the restrictions around sheltering in place, allowing for greater economic activity. That's a great thing. You have more types of business operations and activity that are going to continue to take place over time. The challenge is, especially in the short-term interim, is you have a situation, and Dr. Aller has touched on this previously, where some people, especially on the lower income spectrum, are actually faring a little bit better with unemployment than they would be if they were working full time. So that is that's a real challenge in terms of labor force and how do you incent people to re-enter into the workplace. I do, in my opinion, see that as being more of a short-term challenge and not a long-term challenge. I think the more you see economic activities increase, not only here locally, but across the entire country, and we get back to some sense of normalcy, I do not see that being a long-term challenge, more of an acute short-term challenge.
And we've weathered huge disasters here in Sonoma County in the past. Is there any precedent for something on this level?
Not that I'm aware of, and Dr. Eiler has the economic data. I don't think there's been anything during our lifetime for all of us that looks like this. I mean, of course, the last major pandemic, well, I believe was 1918, I believe, or 1919. So that massive flu that happened, over 100 years ago. But I don't think there's anything quite like this that has impacted our county broad spectrum across industry sectors, public, private, and otherwise, to the degree and extent that this has.
That's correct. In terms of pandemic, the Spanish flu is probably the best analog in terms of general economic effects. We've had other pandemics happen like SARS and MERS, H1N1, but they have not gone up to the level where there had to be social policy that restricted our economic movements, just in a sense, keep healthcare systems from overloading. This is very unprecedented, and most recessions happen because the markets lead to that slowdown naturally as the costs of continuing in the path we were on start to rise. In this case, the social costs were rising, and there was a very immediate change from a policy standpoint, not necessarily from an economic standpoint, that we went into this. So it's also somewhat unprecedented how we entered this situation. And to a certain extent, this is maybe on the more positive side, more optimistic, we're going to exit it in a way that is actually somewhat normal with recession, during a recession, because we've had so much policy come to bear on this. The key is we need to lift the social policy to actually see all those policies bear fruit. So that's the key right now, is just to get open and do it right, to where we don't end up having to put more restrictive social policies back on and potentially have a repeat of this.
So let's talk more about that, because right now it looks like we haven't even begun to see the possibility for the impact in terms of the healthcare system. There's still a very large potential for this to spread within the community. What if we do have to put some of those restrictions back in place to save our healthcare system? What other impacts do you expect to see?
I mean, I think that's a great question. I think we will see something similar to what we've seen in the very beginning of sheltering in place in terms of the economic impacts. And I do think, in my opinion, because I'm not an economist, is that you would probably see more businesses that would have permanent closures. I think there is only a finite amount of time which most businesses can sustain long-term closures, and before they get to a point of no return is what I would think about that. And I do think I would see more, we would all see more permanent closures if we were to have a repeat and have to pull back. I know that with the county's position, it is really to reopen as quickly and as safely as possible. Mitigation measures are going to be critical, and everyone's going to really have to do their part in terms of safety. And that means physical distancing, that means great hygiene and sanitation, and those other mitigation measures to prevent exactly what you're talking about.
I will add 2 extra items to it, is that no matter what happens, the cost of doing business is going to rise in the short to medium term, because we're going to have some social policy shadow over the business community, regardless, with the idea that there may not be any choice, and we will repeat this episode, at least in terms of the disease coming back in the fall and winter. So if we have a relatively smooth reopening and we have very few, let's say, cases versus the predicted, the cost of doing business is going to rise to try to mitigate the comeback and try to remain open. The critical factor is that public health is still going to ultimately decide the fate of our situation as it is now. Lassen County, for example, if you haven't heard, I think the news just came down yesterday or this morning. Lassen County reopened and is now shut down again because the number of cases went up enough to where the parameters for public health were reached, that they told everybody, if we get to here, public health is going to shut us down again. And that's exactly what happened. So Sonoma County certainly doesn't want to do that. And the way Sheba said that is 100% on the money. That it's not only the economics, but it's also the health. And the health ultimately is going to dictate the way in which we reopen and stay open. And the business closures, exactly the point. The business closures issues is the biggest issue to watch, and it will be exacerbated if we go back into shelter in place, no doubt about it.
So it sounds like a pitch for everyone to follow these shelter in place orders as best as possible so that our businesses are able to stay open and we don't have to walk this back.
Absolutely. I would agree with that 100%. It really is everyone doing their part. And my experience has been when I talk to all these different businesses and industry leaders, regardless of industry sector or operation type, people want to do the right thing. They take the safety of their staff very seriously, and they take the safety of their consumers very seriously as well. And so I do believe that there's a great deal of trust that we all have as we navigate this together to make sure that we're all doing our part to make the community safe and to ensure consumer confidence as people re-enter spaces after socially distancing for so long.
In May, the Sonoma County Latino Leadership Organization called Lo Cien held an online town hall. Word was emerging that a disproportionate number of those in the Latinx community were becoming infected with the novel coronavirus. In a moment, we'll hear from Ana Lugo, founder of Equity First Consulting, and Gabriela Orantes, the Just Recovery Fellow from the North Bay Organizing Project. But first, Steve Mencher talks with Lisa Carreño, CEO of United Way of Wine Country. She's also a board member of Lo Cien. She explains how Lo Cien's approach to the pandemic is informed by its long-range view of the Latinx community and what it calls its Latino scorecard.
Last year, we began to identify several specific factors that we want to study: political participation and representation, education, financial stability, neighborhood engagement, health, and the environment. Because what we understand is that while we represent a third of people who live in Sonoma County, we don't all enjoy the same standard of living. And in this COVID-19 environment, we know that while we may all experience the virus, its impact on us varies from person to person depending on your resources and your access to resources. And as we will discuss in just a little bit, COVID-19 outbreak is much higher among the Latino community in Sonoma County than other communities. Fully 2/3 of people who are experiencing COVID-19 positive tests are part of our community.
All right, I'd like to welcome my 2 guests. Welcome Gabriela Orantes, is Just Recovery Fellow at the North Bay Organizing Project, and welcome back to Ana Lugo, founder of Equity First Consulting. Now, we've just heard Lisa Carreño talk about the 2019 Latino scorecard, with the need to follow for a decade deficits that the Latinx community faces in Sonoma County. She talked about issues ranging from financial stability to health and the environment. So I'd like to ask you both how that sets the scene for understanding where we are now and where we need to be. And perhaps I'll start with you, Anna.
Yes, I think that the Latino scorecard, which I had a chance to review a little bit earlier today, is a great follow-up to the other types of reports that have come out in the last few years. I know that many people, especially people working in social services, are aware of the Portrait of Sonoma, which also had measurements, right? They had the Human Development Index. We also have the social determinants of health. We just also saw a report come out of Sonoma Valley. So in combination, all of those really hit at the different needs within the communities in Sonoma County, and also some of the measurements for how we can look at equity.
Gabriela, what do you think that this is a good starting point for us? But if this is a starting point, where do we need to go from here if we want to really understand how equity is going to play into the idea that we need a just recovery from this pandemic starting right about now?
Yeah, so thank you for having me. I am a Just Recovery Fellow. My role is housed at the North Bay Organizing Project, and we, along with 9 other organizations in both Sonoma and Napa, have been working under a framework that is informed by the Just Recovery principles that can be referenced with an organization called Movement Generation. But those 5 principles have really influenced the formation of this partnership. So there are folks who have been working on a just recovery since the 2017 wildfires in our regions. And so to be honest, we've been working, and it's not only these organizations, but definitely the principles embedded in the partnership with regards to addressing root cause remedies and addressing revolutionary self-governance, rights-based organizing, reparations, and ecological restoration. Those are 5 principles that are super important to acknowledge when we talk about a just recovery, because a just recovery for our community, the Latino community, is something that has been on the hearts and minds for all of us. If we're going to go and continue moving towards a recovery that is just, we must address those structural existing inequalities that have been exacerbated. And so that is a call for addressing root remedy causes.
Now, there will be those who say, what we need to do is to get back where we were. We need to get our industries going. We need to get our businesses going. We need to get people, back at work. So if we do those things, Anna, why is that not going to be enough for the Latinx community in Sonoma County?
I think that my question to the people who want to get back to where they were is, when in history have we gotten back to where we were, right? I think that one of the important things to understand, acknowledge, and accept is that we are consistently evolving, right? Our world looks very differently than it looked 100 years ago. And so the more we try and hold on to what used to be, the less space we provide for changes in a way that are transformative. And by that I mean, the systems and structures in the US society were founded on racist ideals. And so I think that if we can acknowledge that without placing blame on individuals, but just understanding through our knowledge of history that this is how the systems were created, and allow space for change and transformation, I think that the framework that Gabi talks about is great. I think that the framework and the different key points that Lucien has also lifted up are great, right? Lucien is really doing the job of putting the amazing work that people on the ground do, that people of color, that leaders, that allies, right, do on the ground every single day, and putting it into a 2-pager, which, obviously does not capture all of the amazing work or names or credit to the people that do this work. I think if we look at, civic engagement, education, I mean, let's talk about education for a second, Steve. The deep concern that exists right now locally with our educational institutions around how do we protect our children if schools do not have the appropriate resources to protect them? And, that is a huge topic of conversation that I think in the bigger scheme of things we tend to forget about, but these children are the future, and many people have children in the public school system. And let's also talk about the fact that public school is brown, right? Majority brown. It is a fact. So how do we really create equitable systems that can serve and protect the people that are most vulnerable, and that are vulnerable not because of who they are, they're vulnerable because of the way in which institutions and systems are shaped.
All right, Gabriela, let me give you the last word, and I know our time here is just so short, but I'd like you to let me know if you think that the county is on the right track. Are they convening the leaders that they need to convene? Are they talking to the people who they need to talk to make sure that every single person in this community will have a say, will have a voice? And they've pointed to, well, we're meeting with Latino leaders on Wednesdays, and we have a healthcare committee that talks on such and such a day. Are they doing enough right now, or do they need to be doing more?
They need to be doing more. I think what we're calling out is the gaps that exist, and so there is an opportunity to be called in to those conversations. And it's not just the Latino leaders of organizations, but it's the community on the ground, to be called in to be able to shape and inform the policies and the responses that directly affect us. And so it is about not just stopping with, oh, we checked off and got these EDs or this fellow or these key leaders. It's about ensuring that the table is expanded and includes more voices, directly those that are affected.
Last week, Santa Clara County health officials released data on COVID-19 deaths that confirmed inequities some leadership already suspected. As here in Sonoma County, people of color in Santa Clara, particularly those residing in 4 zip codes of East San Jose, have been disproportionately impacted by the coronavirus pandemic. South Bay reporter Pamela Lawrence spoke to Supervisor Dave Cortez to find out how the county plans to respond.
So what actions are being taken or can be taken to, give that vulnerable population some relief?
It troubled me that while we were telling people beware and stay away, and do not mingle with others or try to avoid areas of contagion, we weren't really telling them where the clusters were, where the areas of contagion were popping up, or geographically or even demographically for that matter. And now we have a lot of that information out in the public, and it clearly indicates that among people of color, particularly among African Americans, Latinos, and the Asian population, now all of a sudden we're seeing, we're telling you now 8 weeks, 9 weeks into this that there has been concentrations and overrepresentation of this virus among certain demographics, and then when you correlate that to other data and other factors, it's clear that it's oftentimes those same folks who are doing the frontline jobs that aren't frontline healthcare jobs, but they're frontline at Walmart, they're frontline at the delivery service that's bringing your food, or the person who's bringing the food outside the restaurant for you to pick up, or the person who's working in the restaurant, on and on and on.
Santa Clara County opened up a bunch of free testing sites. Is that the path forward? Is that how we get out of this?
Yeah, there's a lot of confusion about that, I think, among constituents, because there's, and rightfully so. I mean, people say, what good does it do if I go get tested today and I contract the virus 2 days from now? Or what if I contracted it a month ago and I didn't know. I was one of these people who didn't have symptoms, which is a large number, evidently. So we're encouraging people to get tested, not because it's going to give you any kind of a hall pass or, a lifetime degree in good health here or COVID prevention, but because for every 10 people who go and get tested, there's going to be a percentage who maybe one, but there's going to be a percentage who test positive. And to get a massive movement going to fill these testing centers up, which are free now, what that'll get us comes back to the contact tracing.
Through a partnership with the county's Office of Labor Standards Enforcement, Legal Aid, and the Fair Workplace Collaborative, the Santa Clara County CAN, or COVID-19 Assistance Navigation Hotline, was launched. County residents can call for information about the various resources available to them during and after the pandemic. Jessica Vollmer gave me the details, and we'll have the hotline information for you at the end.
We launched the COVID Assistance Navigation Hotline here to be this one-stop shop that could connect folks to all of the social safety net resources that are available in Santa Clara County, provide very technical assistance for the processes for filling out unemployment insurance applications and other types of income replacement applications, and then also be able to directly connect folks to our legal advice line if there were more eligibility questions. So folks trying to figure out what in fact should they apply for in that, the bevy of income assistance programs that we have available. We also have through CAN, the CAN hotline, and through our legal advice line, really stayed up to date on the different programs that become available, like the Pandemic Unemployment Assistance Fund that is available now for self-employed folks, including gig workers. And then now we have the funding that's available for undocumented families that was released by the state. And so just making sure that folks know where to go to be able to get all of those resources that they are eligible for as well.
So the hotline's been pretty active, I would imagine, over the last couple of months.
It has been. It has been. We have fielded, where are we at now? Something like 19,000 actual phone calls. Our hotline, the legal advice line, as well as CAN offer or have folks that speak multiple languages. So we have language capacity in English, Spanish, Tagalog, Vietnamese, Cantonese, Mandarin. We anticipate that as this, even as we start to open up more as a county, that there are going to be repercussions from the shelter in place and the hit that our economy has taken that are going to be felt well into the future.
Thank you, Pamela Lawrence, for that great report. Now, what will our schools look like when they reopen? Co-host Adia White spoke with Lori Fong, president of the Santa Rosa School Board, about the inequities the pandemic is bringing to light and what we can do to resolve them.
This pandemic has really taken off the veneer of that we are okay, that we're functioning okay, that everyone's got their slot and everyone's doing okay. Because you take off, you scratch below that surface for just a little millimeter, like the pandemic has gone even deeper than that. And we are finding that, of course, as everybody knows, and I think you're going to be hearing everywhere, that it is hitting harder on the poor communities of color. We know that of all the kids affected with COVID in our county, 95% of them are Latinx. And our supervisors are giving those statistics every day that it's hitting harder the poor communities, the Latinx population.
And are there any other aspects that have brought to light some of the inequity that we're seeing in schools? For example, distance learning. I know that some families have better access to internet than others and things like that.
Early on, we knew that for remote emergency teaching is what I like to call it. It's not distance learning by any means. It's an emergency. We turned on a dime. Our teachers put together packages of learning hard copy and online learning within 2 weeks, and as did many, many other districts in all schools across the country. So the digital divide is what we call it. You know, we handed out probably a third of our kids got Chromebooks. We handed out Chromebooks for free. We handed out, oh gosh, hundreds and hundreds of hotspots, including to teachers. Hotspots for kids to have connectivity. So at home, if people are living with weak broadband or no broadband internet, or they're living with one device shared by different people in the family, and maybe this Chromebook that we're handing out is a device shared by more than one kid, it's not okay. Then we have other kids who have their own bedroom, who have their own computer, who get to shut the door, who have, you know, high-speed internet in their houses, and good for them, but the divide is glaring. And so we are trying to plug that equity gap. And that's not just a hardware equity gap, it is a human resource equity gap. So our parents able to work from home. If we're talking about our parents who work in the service industries, they're having to go to work. They're having to go to work at the fast food industries. They're going to work in the grocery industry. They're going to work in the healthcare industry. So either they're going to work and leaving the kids home with who knows who, or they're not working and no salaries. So it's really hitting those at the lower end of the wage scale. As we know, wealth inequality in our country is off the charts.
What do you think schools will look like once we do start to reopen?
There's no shortage of roadmaps, you know, quote unquote roadmaps or plans and templates about how to open school. And many of them include things like some online learning, some in-school learning. When they do get to school and come to school, we're talking about half-size classrooms or fewer. So just imagine you're sending your third grader to school, and that third grader classroom has maybe 30 kids, maybe 28, maybe 24, maybe 32, and half the kids go. And you space out the desks, and the teacher is teaching them for 2 or 3 hours a day. Then they go out to the playground. And they're washing their hands, and they're staying separate. And when we have kids together, and we put kids together a lot to work in groups, and they work in partners, how are they going to do that? How are 8 and 9-year-olds going to stay apart, 6 feet apart, in their group work to do their math, for example? And will the teacher have to be the disciplinarian constantly? Stay apart, don't touch each other, keep your mask on, if we wear masks in class, and wash your hands. And then we go out to the playground. And how are we going to keep kids apart there? And then also, many, many, many classrooms do not have sinks. Most of the high schools and middle schools don't have a sink per classroom. Elementary schools, some of them do, some of them don't. So how do we wash hands? And there are not that many bathrooms in schools. I think every kid knows that. How do we manage that? How do we manage busing? Generally, we pack about 40 kids onto a bus. We can't do that anymore. And so that we need double bus routes or triple bus routes. And so there are not enough buses, not enough bus drivers, time to get to and from school. So let's say we send that kid to school for a few hours in the morning, go home, and then what do? Are their parents home? Or we send them to school 2 days a week. What happens to them the other 3 days of the week? And so there's all kinds of things that have guidelines and templates who've been put out. For example, just yesterday, California Public Health put out nail salons, hair salon guidelines. Very dense document. If we would analogize that to schools, we couldn't do it. Oh, who's taking the temperature every day, right? That's another thing. It's going to be difficult, but we're going to figure it out. But what we really need to do, and what I'm urging all school board members across the county to do, and our elected leaders from local to state to national, is that we need to fundamentally shift things. It's not just enough that we have to wash hands and stay apart until this is over or until we have a vaccine, and schools are different. We have to shift how we look at all the systems and all the sectors in our communities that support each other. So for example, workplaces, employers, how can they shift work so that parents can work remotely, continue to work remotely if they don't have to, or have flexible schedules, flexible work hours so that they can be home with their kids if their kids aren't going to be in school the whole time. How can we shift transportation in our county so that we can help get kids to and from places where there's more room and they can be apart and not just packed into 40 kids in a bus? How can we shift outdoor spaces for learning, parks and recreation? How can they shift their camps and their outdoor recreational times to be year-round and not just packed into the summer? Because if we were to stagger school time and draw things out, we have to not only think about, hybrid or staggered times during the day, but we have to think about days of the week. We have to think about weeks of the year. I mean, why are we cramming 180 days of school in 9 months? We have 3 months of summer that we can use to pull things apart. And it doesn't mean that families can't have vacation, because you're going to be squeezing vacations in 2 weeks at a time, 3 weeks at a time throughout the school year. I mean, that kind of timing model for the calendar is an agrarian model, an agricultural model, an industrial model that does not serve us anymore. So it's time to shift to these kinds of things. We can't fit back into the same box that we were in. And we need people together to start thinking about these things.
Well, thank you so much. That's about all we have time for. But is there anything else that you'd like to add that I didn't ask you that you think people should really understand?
Class of 2020. And so I think this might be airing after graduation, but let's just, we heard graduation speeches, and every single one of the graduation speeches, these valedictorians were so inspiring, and they know that they can do it because they've lived through so much these past 4 years.
Congratulations to the class of 2020. San Francisco students Julian Jordan and Kyle Trefny were among high school seniors nationwide who lost the chance to celebrate their graduation and many other milestones this year, but they decided to make an animated commencement address in honor of the class of 2020.
Dear class of 2020, I wish that the path to this point had been easy. But since we started high school, this road's been changing under our feet. We've faced hurricanes, floods, and wildfires. Violence in our neighborhoods and on our campuses. We've lost icons we admired so much, and loved ones we miss so dearly. We have believed, and sometimes we walked out of school for our beliefs. Then 2020 came, our year. Well, we all know what's been happening. But fellow graduates, maybe we weren't made to walk that easy path. These crazy challenges in high school have been our mountains, and we're learning to climb. If these years are supposed to prepare us for life, maybe what we're figuring out is not only how to hunker down and deal, but how to get involved, to do our part, to do extra, so we face our challenges head on. Although the road before us isn't easy, we've got to remember we are not alone. Our families, our teachers, our mentors, and our communities, they've helped us get where we are. Plus, we've got each other. Together, we'll always find our way across the stage. So, fellow graduates, as we turn this page in our lives, let's step into this moment. Let us each find how we will give back and make post-quarantine life safer, kinder, and more sustainable than before. Because we're not just ready to be in a world of change. We are also ready to be the change in the world.
This is our last coronavirus town hall, but we'll continue to cover this story on TV and radio. It has been our privilege to join you for the past 13 weeks. We've received hundreds of your questions, and we've answered as many as we could each week. This virus has caused the most profound change in our lives, with more than 100,000 Americans dead and no effective treatment or vaccine. There is still so much more we have to learn about this disease, as thousands are at work to move this science forward. And then, on Memorial Day, everything changed again, and for the past week, the nation has been convulsed with anger. As a community, where do we go from here? This coming November will likely be the most consequential election in our nation's recent history. It will matter who you vote for in your community and who you choose for president. Our commitment to continue a dialogue with you about what is important in your life and make every story starts with you. Good night, and thank you for sharing your Tuesdays with us.
The staff of NorCal Public Media and La Mejor Radio thank you for watching the past 13 weeks of these live interactive town hall programs. And although, as Adia said, this is our last program in this series, as we move forward in covering the coronavirus crisis, we want to know what topics are of most importance to you. You know, we've talked about the opening of businesses, the stay-at-home orders, and the relationship with government and the people. So let us know, what do you want to hear? And we'll cover your ideas in television reports and radio news reports and also in online digital stories. So look to NorCal Public Media, and don't forget to visit the website norcalpublicmedia.org/coronavirus to keep up to date. And remember, you can share your questions, your concerns, your story ideas, all by visiting the form at norcalpublicmedia.org. The contact form is displayed on every page of the website dealing with the coronavirus outbreak in the Bay Area. So keep tuned in to NorCal Public Media for the latest coronavirus news. Remember, you can get all of the news and information that you need by watching the PBS NewsHour here on KRCB. And on KPJK, there's a variety of great news and information available through DW News and FNX. Now, one thing that we're very proud of is on KRCB FM, which you can listen to over the air on 91.1 or 90.9, or online with any listening device or any service that you use. We present a coronavirus radio news update every single morning with Adia White and every afternoon with Steve Mincher. So 5 days a week, we're doing 10 reports on coronavirus news and updates on KRCB FM 91. So make sure to tune in for those. Visit the website norcalpublicmedia.org/coronavirus to get all the news and information you need. And don't forget to keep in touch with us and let us know what you want to hear about. Send us your questions, your comments, and concerns. We're here to report for you. Thank you so much for watching. I'm Darren Lashelle with Adia White for NorCal Public Media, and good night.
You're watching Northern California Public Media, made possible by viewers like you.